Well, negotiations between United Nations member nations for the World Health Organization's Pandemic Preparedness Treaty have resumed this week after reports of countries struggling to agree on a draft proposal. I wonder why that might be. Joining us now with the latest is Dr. David Bell, formerly a World Health Organization medical officer who's here in Australia, speaking and warning, David, about this pandemic treaty. Welcome to Outsiders, David. Thanks for coming along. Tell us in a nutshell why Australians should be worried about I know there are two aspects to it, but basically the World Health Organization pandemic treaty preparations.
Yeah, thanks for having me on. Well, you saw those clips you showed from Melbourne from a couple of years ago, and it's worth remembering that was a virus that kills people on average at the age of 80 or greater, and people who are already sick. But that was a reaction to it. These treaties, they basically hand decision-making for what is a pandemic emergency and what the response should be to the World Health Organization from national governments. And the decision-making, we saw they've already, that they declared an emergency for monkeypox, they did that when there was 5 people dead in the whole world. So it was a pretty low threshold. And so it's based on a fallacy that we have increasing risk of pandemics, increasing number of outbreaks. There's a report out from the University of Leeds recently that shows that this is actually using the data that the WHO, G20, the World Bank use, that it's the opposite, that actually for the last 10 to 20 years, we have a reducing risk for all sorts of reasons, and we can just detect pathogens better. So the treaty is, or the two instruments, they're putting together a system where about $30 to $40 billion of public money, which is about 10 times what you spend on the WHO now, will build this huge surveillance system that will find viral variants. They'll have lockdowns, they'll have a 100-day mRNA vaccine. You just discussed a similar vaccine and the problems with that. And that will be the path back to freedom. And the profits from this will go to pharma. So it's really a huge business scheme on an international level we haven't seen before, to channel public funds into pharmaceutical companies and investment houses that own them, and in the process impoverish the population and take away the basic freedoms we thought were ours.
James.
David, I just want to ask you about the WHO. We saw their performance during the COVID pandemic, and we saw the way Tedros and other officials basically slow-walked any investigation of China and the origins of that. And now we have people talking about H5N1 and a bird flu virus and things like that. Why on earth would anybody trust the WHO?
Because they still think it's the sort of organisation it was maybe 70, 80 years ago, where the countries gave it money, and based on what are the worst diseases, where you can make the most difference, and what countries asked for, it would respond and do something useful. That's all changed. Now about 80% of its funding is specified, which means the funder just tells the organisation what to do. So it's not an independent organisation, it's a tool of the funders. And about 25% of that funding is private. That's either pharmaceutical corporations or big investors in pharmaceutical corporations. So it's become a tool of these corporations. They use it as a public-private partnership to improve the returns on their investment. It's not, and that's why they would do it, because this is about, in the end, it's about making a lot of money.
Rita.
Well, we saw the world follow China's example and employ lockdowns, abandon their pandemic plans that they had in place and just follow China. How much influence does China exert over the World Health Organization?
Well, it exerts a lot, and in a way it should, because it's 1.3 billion people, and the WHO should represent, the people of the world. But in saying that, it obviously shouldn't be able to tell the people of the world what to do or to have much influence at all on what they do. So China has a lot of influence. They give very little money. In the last 2 years, they gave less than Nigeria, or I think, a couple of times. Yeah. So, but they have a huge influence politically on who gets the top job, the Director General. So through diplomatic means, it's a vote by countries. You influence low-income countries, etc., on how they vote, and in return they'll get some deals from China. So that's what all countries do.
So very quickly, David, before we go, what would be your advice, or speaking directly to the Australian government, what would you be saying?
Well, at a minimum, put off this vote. They're still negotiating these. They're supposed to be legally binding documents, and 2 weeks out from the vote, they're still negotiating. There's really no idea what the finance behind it is, etc. They haven't decided what they're going to do with these documents. But I mean, it's based on a fallacy. Essentially, they should vote no, but at a very minimum, they should put this off and have a better think about it before we go forward.
David Bell, thanks so much for talking to us on Outsiders and warning us there about the World Health Organization. You got that? Government, vote no. Liberal Party, let's hear from you. Vote no. How often have we been saying this for years? Let's get the Liberal Party strongly opposed to this. I know Peter Dutton is. Let's get them absolutely opposed to pushing forward with this World Health Organization madness.